BSI, scene safe. But the first thing I'm going to ask is my mechanism of injury. My mechanism of injury is going to be bilateral wrist lacerations. I'm going to ask, how many patients do I have? I'm going to have one. I'm going to ask, do I need to consider C-spine? And do I need to consider ALS? Okay. I am going to consider C-spine. I'm not going to consider ALS at this time. Upon arriving to the patient, I'm going to get a general impression. My general impression is that I have a 50-year-old male. I notice that he has bilateral venous lacerations to his wrists. So the first thing I'm going to do is I'm going to apply pressure to both lacerations. All right. Quickly. I'll have my partner continue to hold pressure on the other wrist while I am bandaging this one. Okay. All right, I'm going to bandage the other wrist. Meanwhile, I'm going to assess my level of consciousness. Sir, can you tell me your name?
Mike.
Mike, all right, Mike. Can you tell me where you're at right now?
I'm in my bed.
You're in your bed. All right. Can you tell me what time of day is it? What time of day it is?
Afternoon.
Afternoon. What'd you call 911 for today?
We felt depressed and decided to try to commit suicide.
I'm sorry about that. We'll get you some help, all right? So my patient is talking. I do not notice any airway obstructions. I'm going to assess my patient's breathing, how many times per minute he is breathing. Let's say I noticed he is breathing 24 times a minute, non-labored. I'm going to assess his circulation. I am unable to take a radial pulse, so I'm going to take a carotid pulse for 30 seconds. Let's say that his pulse is 100 beats per minute, weak and irregular. I'm going to assess his skin color, temperature, and condition. Let's say it's cool, pale, and diaphoretic. I suspect this patient is in shock, so I'm going to treat for shock with 15 liters per minute of oxygen. I'm going to give him a blanket to keep him warm. And then I'm going to immediately begin transporting this patient. Okay? Once we're in the back of the ambulance, I'm going to go ahead and begin a history taking. So sir, I'm gonna be asking you a couple questions, okay? So besides feeling depressed and deciding to kill yourself, is there anything else I should know about? How are you feeling?
Nothing.
Nothing? All right. Are you allergic to anything?
No.
Are you on any medications?
No.
Do you have any past history?
Depression.
Depression, okay. Have you attempted suicide before?
No.
All right. When's the last time you had anything to eat or drink?
This morning.
This morning, okay. Well, what time this morning?
8 o'clock.
8 o'clock. All right. And then what was happening right before you decided to do this?
I just felt depressed.
You just felt depressed, okay. So there's my sample history. I'm going to go ahead and take a set of vital signs. I'm going to recheck my pulse. All right, still 100 beats per minute, weak and irregular. I'm going to reassess my breathing. Let's say it's 22 breaths per minute, regular and non-labored. I want to go ahead and take a blood pressure now. Okay. Let's say his blood pressure is 108/70. Okay. Now I'm going to begin my secondary assessment. I'm going to begin at the head, and I'm going to go looking for DCAP BTLS. D is for deformities, C is for contusions, A is for abrasions, P is for penetrations, B is for bruising, T is for tenderness, L for lacerations, S for swelling. Okay? So I'm going to start at the scalp. I don't see any bleeding or feel any malformations. I'm going to assess the facial bones, looking for any DCAP BTLS. I'm going to assess the nose. I'm going to look in the ears. I'm going to check in his mouth. Okay, no. I'm going to assess his eyes. Make sure that they are equal and reactive to light. Okay. I'm going to move down to his neck. I'm going to assess the trachea to make sure it's midline. I'm going to check his jugular veins to see if they're distended. Okay. I'm going to move down to the chest. I'm going to inspect the chest. I'm going to palpate the chest, checking for any deformities. No. And I'm going to auscultate the chest. Listen here, breathe in. Listen here, breathe in. And listen here, breathe in. And I'm gonna listen here, breathe in. All right. Next, I'm gonna move down to the abdomen. Move this real quick. All right. I'm going to palpate all 4 quadrants of the abdomen. Does it hurt when I press?
No.
No? All right. I'm going to check the stability of the pelvis. All right. All right, sir. Are you having any pain, bleeding, or incontinence that I should know about?
No.
No? All right. Next, I'm going to move down to the legs. I'm going to assess. I don't see or feel any decap BTLS. I'm going to check circulation. Motor, can you wiggle your toes? And sensory, which toe am I touching? All right. Assessing the legs. Pulses are present. Can you wiggle your toes? Which toe am I touching? All right. Now I'm going to focus on the arms. All right. Okay. I'm going to check my bandaging to see if the bleeding is controlled. Okay. I'm going to assess circulation. Can you squeeze my hand? Motor. And then sensory. Which finger am I touching? All right. I'm going to do the same on the other arm. I'm going to reassess my bandaging to make sure it's still holding. Close. Can you hold my hand? Squeeze my hand. Okay, which finger am I touching? All right. I do not suspect this patient has a spinal injury, so I wouldn't put him on the longboard. I would reassess this patient every 5 minutes, beginning with his level of consciousness and his ABCs on our way to the hospital. And I am now done with the station.